Welcome to HealthWatch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. Today we will talk with Shelburne Stevens, president of Novant Health Brunswick Medical Center, regarding a new building that's underway in southern Brunswick County. Then Robin Ashmore of Novant Health and Julie McQueen of Susan G. Komen, North Carolina Triangle to the Coast affiliate, who will join us to talk about financial assistance that's available for local women needing mammograms. Next, we will talk with Wendy Cifelli and Jean Lynn King about the hospital's upcoming golf tournament. And finally, we will speak with Olda Semplowski, a physician assistant who has joined Oceanside Family Medicine and Convenient Care in Charlotte. Stay tuned to learn about valuable health topics with HealthWatch. Our first guest is Shelburne Stevens, president of Novant Health Brunswick Medical Center. Well, welcome back to the show today, Shelburne.
It's good to be back, June. Thank you.
Well, it's a pleasure to have you here once again. And I know that most of our folks out there have met you, but we're going to give them another opportunity just in case they missed that. So how long have you been in Brunswick County?
It's been 9 years now, June.
9 years. It goes by so fast, does it not?
It flies by.
And where were you prior to moving to the area, Shelburne?
I lived in Winston-Salem before moving here to Brunswick County.
I'm sure that we have viewers out there who are really interested in your background and your education and your experience. Can you share that with us?
Sure. I started my career in healthcare as a respiratory therapist, working with both adults and neonates, and then had several leadership positions and went back to school and did my MBA at Gardner-Webb University, and then moved here to the coast, and I've enjoyed my whole 9 years here.
You're living the life, right?
It's nice. It's a great place to be.
It is. Brunswick County is a wonderful place to live.
Absolutely.
Well, I heard some exciting news the other day. I hear there are plans underway for the southern end of the county, and I'm hoping you're going to share that with us today.
Yeah, we got more than plans. We're moving dirt at the southern end of the county. So we have begun the construction of a medical plaza in the southern end of the county. If you remember, we bought some land several years ago on Highway 17 and Persimmon Road.
Right.
And so we've started moving dirt, and we're building a medical plaza there.
That is so awesome. How convenient that's going to be for the folks who live in that southern end of the county. Well, tell me when you're going to open.
We open in 2016, probably second quarter of 2016. We'll have not far off at all. We'll have several services going in there.
Yeah, tell me about that.
We have our existing Calabash internal medicine clinic that will move in there. There's also imaging services.
Oh, okay. And you say the Calabash internal medicine group is going to move over there?
Yes, we're giving them more space. They have a small clinic today and can't continue to grow, so they'll have a lot more exam rooms.
Great.
We'll be able to add more providers, and there'll be a lot more parking.
Oh. Are there any other existing clinics that will be moving in that facility?
We do. We have a couple of specialty clinics. Our OBGYN group and our general surgeons have offices at Sunset Beach, and they'll be moving their timeshare spaces into the building as well. So we'll have everything in one medical plaza there to serve those residents in the southern part of the county.
So we'll have OBGYN?
OBGYN and general surgeons.
Wow, that will be great. But they'll also keep their other offices open, is that correct?
Yes, they'll keep their offices open next to the hospital and then their other satellite locations throughout the county.
There's some in Leland, I believe. And
there's Leland and then Southport.
Southport, yeah. So covering the county pretty good.
That's what we're trying to do.
Yeah. Did I hear you mention imaging services?
Yes.
Tell me a lot about that.
Great. We're really excited about both the clinics and the imaging services. We will have both a freestanding imaging center. There will be radiology, just x-ray, and also ultrasound will be available. And then we'll also have mobile mammography and mobile MRI services that will come to that complex.
Now you say freestanding imaging. How does that differ from like what's at the hospital or?
Well, number one, it'll be more convenient for the residents there, but
Sure.
it's usually a lower copay for the patients that go there, so that'd be very attractive to those
That
residents.
will be very attractive. And the mobile units will be MRI and
mammography.
And mammography. And did you mention ultrasound?
Yes, ultrasound. So if you have to go have your gallbladder scanned,
Oh,
or
okay.
if females need to go have something scanned, that will be available 5 days a week.
5 days a week. So wow, that is a full service
It is.
area. Well, that's really good news for the county. I mean, it's such a large county,
It is.
and those folks have to drive quite a ways if they're coming up to supply. So that's a great area there. And tell me about the feedback you're getting from the towns and what have you.
Everyone is very excited.
What is that town? Is that?
It's Carolina Shores.
Carolina
But
Shores.
it's connected to Calabash. So we've been
They're
working
kinda
with.
real close.
They are. We've been working with both groups, and they're very excited to have us there, and they've been great to work with. So we're moving right along. You'll see construction starting. The land has been cleared, and people are very excited in the southern end of the county. And we're really just trying to get the services closer to those residents and have access available and make it more convenient.
Yeah, and I assume you'll have a big groundbreaking or not a groundbreaking, ribbon cutting?
Yes, we're planning several events because we're really
Good.
excited about kicking that off.
Well, thank you so much for being here today, Shelburne.
Thanks for having me, June. It's always a pleasure.
It's been a pleasure, and I'm so excited about this new building. Give me that address again. I'm not sure I know where that is.
We're right at the corner of Persimmon Road and Highway 17. You can see where they're moving dirt already. So we're really excited.
So folks can see it already moving.
Absolutely.
Great. Well, thanks again, and I hope you'll come back when you have the ribbon cutting, and we can talk some more about the services.
Absolutely. Look forward to it.
Great. Our next guests are Robin Ashmore, Imaging Manager for Novant Health Brunswick Medical Center, and Julie McQueen of Susan G. Komen, North Carolina Triangle to the Coast affiliate. Welcome, Robin and Julie.
Thank you.
It's such a pleasure to have you guys here today.
Thank you for having us.
You're welcome. And Robin, I think we'll start with you. So tell us what your title is and what your role is at the hospital.
Well, my name is Robin Ashmore. I'm the manager of imaging services at Novant Health Brunswick Medical Center, which includes our satellite X-ray facility in Sunset Beach.
Good. That's a big job.
It
A
is.
lot of services there.
Yes.
Now, Julie, how about you? Tell us a little bit about yourself and your role at
Okay.
Susan G. Komen.
Well, my name's Julie McQueen, and I am the Director of Community Health for Susan G. Komen, the North Carolina Triangle to the Coast affiliate. And in my role, I oversee what we refer to as the mission work of our affiliate. And the Komen mission is to save lives and end breast cancer forever. And so I manage and oversee our community health grants program, our breast health education, and our community outreach services.
That is a big job
It is.
and a wonderful, fulfilling job,
It
I'm
is.
sure.
It is. The money that we raise, we grant out to nonprofit organizations that provide breast cancer education, screening, treatment, and support programs for the uninsured and underinsured people that reside in our service area.
Right, right. Wow, that's great. Well, it sounds like both of you are very busy and have very busy roles. But Robin, I understand that recently you got some exciting news from the Susan G. Komen, North Carolina Triangle to the Coast affiliate.
Yes, we did.
So tell me about that.
We did. Novant Health Foundation Brunswick Medical Center applied for a grant from Susan G. Komen to help us provide mammograms for underinsured and uninsured women. And we received a grant for the total of $46,150 to help with that.
That is totally amazing.
It's wonderful.
What a great gift. What
Yes.
a great gift. So these funds will be able to be used to benefit women right here in Brunswick County. Is that
Yes,
correct?
Absolutely.
Well, can the funds be used for anything outside of mammograms?
Well, if there's a female who qualifies for the grant, then those funds can be used to follow if she has to come back for a diagnostic mammogram, an ultrasound, or a biopsy.
Wow, so it'll follow that patient through the
The whole process.
whole
yes.
process. That's great. Well, Julie, tell me a little bit more about the grant dollars and why Komen decided to provide this wonderful grant to our community.
Well, first of all, I want people to know that the money that we raise, 75% of those net proceeds stay right here in our local community and fund, it's given to organizations like Novant Health. And then the remaining 25% we send to the Komen National Research Grants Program to fund cutting-edge research that will hopefully one day lead us to a cure for breast cancer.
Right.
But most of the money that we raise stays right here. And we each year we put out a request for applications and invite organizations to apply for our money. And in 2012, Brunswick County was added to our service area. So this year we were so thrilled to find out that Novant Health Foundation Brunswick Medical Center was applying for these funds. And all of our applications are reviewed and scored by an independent review committee.
Oh.
And so when the process was done and we learned that we were going to be able to partner with Novant Health to provide these mammography services, we are all really excited about this opportunity because we know those services are really needed in this area, and we're really proud to be able to work with Novant Health to bring this to this area.
Well, I think hearing all of this, I think the most important thing is we get the word out to women and we let them know how to gain access to those funds. So, Robin, can you speak to that?
Absolutely. To qualify for this, women need to be age 40 or older.
Right. They
need to have not had a mammogram in the past year, be uninsured or underinsured, and live in Brunswick County.
So to me, that's wonderful. It's just designated for Brunswick County because I said it's so big. There's so many women here who need these services. So that's wonderful. Now, let's talk about where they're available.
At the hospital, the main hospital, we do them 6 days a week, Monday through Saturday. And then once a month, we have a mobile mammography truck that travels around Brunswick County. So it's 1 week a month to do that. They can call our scheduling department to get information about the mobile or to schedule the exam right there on the phone, and that number is 910-721-1485.
So the Komen funds are available whether it's done at the hospital or in the mobile coach, correct?
Absolutely, yes.
That's great. The mobile coach is very convenient. I know it tries to go to outlying areas of Brunswick County and target those communities where it is most needed. Yes. But also I think it's gone to businesses and just local venues. And it is much more convenient if they can make that work. But if not, they can always come to the hospital.
Yes.
That's great.
We know that early detection saves lives. And we feel like all women should have access to a yearly mammogram. That's their best chance to find their breast cancer early. And so, and that means it has to be convenient, accessible, and affordable. And this grant does all of those things.
Yes.
Yeah, I think that's probably the most important thing is just preventive care. And we should be entitled to that mammogram. And fortunately, many of us have insurance and we can do that. But there are so many who are less fortunate where these funds will come in really handy. So, well, Julie, as we wrap up here, is there anything else that you can share with us about the Susan G. Komen North Carolina Triangle to the Coast affiliate and how folks in our community can get involved?
Well, I would like people to know that all of us at Susan G. Komen work hard every day to raise as much money as possible so we can fund programs like this. And the more money we raise, the more people we can help.
Right.
So, and we raise money in a lot of different ways. We raise money through our events, like the Komen Race for the Cure, through individual donations, through corporate sponsorships. So we encourage people to get involved. If you can make a donation, that's great. But there's a lot of events that people can get involved with. In fact, there's an event right here in this region every year in March. It's the first Saturday in March. We have the Wilmington Race for the Cure. It'll be on March 5th this year, and we want people to get involved. You can run, you can walk, you can volunteer, you can sponsor, you can form a team, you can support a survivor who is participating.
Oh, that's good.
So we just want people to get involved because working together is the only way that we're going to realize our vision of a world without breast cancer.
Yes, that's true. And I will say that I participated in the race last year in Wilmington, and it was so uplifting, and I felt so good. It is a really feel-good event.
It is.
And
it's a celebration of life.
It
really.
is. It's a celebration of life, and I was so impressed, and I have goosebumps talking about it right now, and it's been that long.
Well,
so
good.
I'm looking forward to this year.
I hope everyone will come out this year and support us.
That's wonderful. And Robin, just one last time, tell us how to make those appointments again.
You can call our scheduling department at 910-721-1485.
Great. Well, thank you both for being here today. It's a wonderful day in Brunswick County.
Yes.
Thanks to the Susan G. Komen North Carolina Triangle to the Coast affiliate.
We're happy to partner with you guys. So
Thank
thank
you.
you.
Thank you for having us.
Now we will welcome Wendy Cifelli, a volunteer for Novant Health Brunswick Medical Center, and Jean Lynn King, Case Management Supervisor for the hospital. Welcome to the show today, guys.
Glad to be here.
Thank you very much. Good morning.
You're welcome. Wendy, let's start with you. Tell me a little bit about yourself and how you became a volunteer at Novant Health.
Well, I'm a retired school teacher from New York, and 6 years ago I came with my husband to North Carolina to get away from snow and taxes. And I had never volunteered in a hospital before. So I looked into Novant, and I found that you meet wonderful people.
That's true.
There's a variety of volunteer opportunities, and I think more importantly, it was meaningful. You get to support the community you're in.
That's true. And we so appreciate our volunteers at Novant Health.
Absolutely.
You do a wonderful job and do so many great things and help with our patients. It's an awesome way to support your community.
And everybody enjoys doing it.
Well, I'm sure they do. How about you, Jean Lynn? Tell me a little bit about yourself and what you do at the hospital.
I am a registered nurse case manager. I'm a supervisor over the case management department. The case management department includes case management, social services, as well as utilization review. We work directly with the patients and their families to ensure a successful discharge plan of care. And depending on what the patient and the families need, we work with outside agencies such as home health, skilled nursing facilities, acute rehab, infusion companies. We do a great variety of services, anything from adoption to end-of-life care.
Wow.
Yeah.
So you kind of coordinate that whole discharge process and
We
make
do.
sure everything has all the patients have a smooth transition to home or
That's
wherever.
correct. We do, yes.
That's awesome. That's a
Yeah.
great service.
It is. It is a great service, and it's something that we love to do.
Yeah. It's obvious.
Yeah.
When you talk about it, you can see how much you enjoy your job. Well, today we've asked both of you to be here today to share some details about the Novant Health Brunswick Medical Center's Foundation's golf tournament. So, as many of our viewers know, I lead the Novant Health Foundation at Brunswick Medical Center, and we are so excited that the volunteers have signed on to help us coordinate this year's tournament. So, Wendy, if you could tell our viewers a little bit more about the tournament and about the volunteers and their initiative to take this on this year.
Well, we're very excited too.
I'm glad.
The volunteers often have fundraisers, and whatever monies that are made are always given back to the community to help support the people here. And this year, when we heard there was an opportunity to partner with the foundation to do such a fun event, we were thrilled, because who doesn't like to have fun? All right. We're much more involved this year than we have been in the past, helping organize things, helping to get sponsorships, and to make sure generally things run smoothly.
Well, we're certainly appreciative of all that the planning committee is doing. It's a big job, and we can use all the help we can get. So we're really happy that the volunteers decide to help with us. So let's go over the basics. When and where?
Well, it's on Friday, September 11th, which tragically most of us remember from 14 years ago. But it's at the beautiful Jones course at Sea Trails Resort, and that's in Sunset Beach. If you're an early riser, it starts at 7:30 with a continental breakfast, and that will continue on until 9 o'clock when there's a shotgun start.
Right.
And there'll be contests and prizes, and then also a delicious lunch when you finish. And we're encouraging people to wear red, white, and blue that day.
That's great. That'll be so much fun. So tell me how a golfer would sign up.
Well, first, if it was one golfer, I'd say get 3 of your friends and make a foursome.
Yeah, really.
But the way you can sign up, whether you're a single golfer or a whole team, is you get a hold of Victoria Bellamy. She is the community engagement specialist at the hospital, and her number is 910-721-1473. You could also ask volunteers because they may still have a packet that's available, and they're just starting to put teams together now.
Great, great. I understand that the volunteers picked a very special project this year for the tournament's funds to benefit. So I'm going to toss it to Jean Lynn because I think she oversees that program, and it's called the Prescription Assistance Fund. Am I correct?
That's correct. We've been so fortunate that we've been able to help so many people so far, and then with the golf tournament and everything the foundation's doing, we anticipate being able to help just that many more.
Well, tell me how it works. How does the Prescription Assistance Fund work?
Basically, once the patient's need is identified, whether that's through a physician or someone in the ancillary staff or through our own evaluation, then we will go to that patient and just do a quick interview just to see, so we can find out exactly what it is that they need help with. Once that's determined, we go back and talk to the physician about it, and there's a special voucher prescription that's filled out. The physician signs it, and then it goes to one of the participating pharmacies, local pharmacies in the area. And then when the patient is discharged, they're able to leave the hospital and go directly there and pick it up. They can pick their medications up at no cost to them. So that's especially beneficial if it's someone who, like a veteran, for instance, who is on a mail order program, so there's no delay in service.
I see.
Yeah.
And this fund, they would only benefit patients who are in the hospital, correct? Being discharged from the hospital or the ER.
That's correct.
But not necessarily folks out in the community who just need help with prescriptions.
Right, that's correct. This is for the Novant Health Brunswick Medical Center patients.
Well, are there any funds out there available to folks in the community? Is there a way or a resource for them?
There are some resources out there. There are some sliding scale clinics that are based on income. There's a few free clinics. There's New Hope and there's Comwell. Some of the pharmaceutical companies will offer some services depending on whether the patient meets criteria. We look into that as well.
And I'm sure you provide that information
we do.
To folks in the community who would call and ask.
We do, yes.
Great. Well, guys, this information has been so helpful. And Wendy, share with our viewers one more time when and where the golf tournament is and how they can get in touch with Victoria.
Okay. It's again on Friday, September 11th. And it's at the Jones Golf Course at Sea Trails Resort in Sunset Beach. And the way you can sign up is to contact Victoria Bellamy, and her number at the hospital is 910-721-1473. And we hope to see everybody there.
And wear red, white, and blue, right?
Correct.
Jean Lynn, thank you for all you do at the hospital. You do a wonderful job. You take care of our patients in such an awesome way.
Well, thank you very much. It's certainly my pleasure.
And it's so good to hear you say that. So thanks for being here today, guys. It was fun. Maybe after the golf tournament we can talk again, and we can learn how many patients we helped.
Okay, that sounds
That'd be
great.
Wonderful.
Thank you.
Thank you.
Our final guest today is Olga Semplowski of Novant Health Oceanside Family Medicine and Convenient Care. Well, Olga, thank you for being here with us today.
Thank you so much for having me.
It's going to be a pleasure. Now, I understand that you recently joined Oceanside Family Medicine and Convenient Care in Charlotte. Is that correct?
Yes, that's correct.
How long have you been there?
I started in March, beginning of March.
Yeah. Well, that practice is really growing. It's absolutely huge. So I'm sure that they were happy to have you on board. Tell me a little bit about your education and your training.
Well, I received my undergrad degree from UNC Wilmington.
Oh,
so
local.
Just around the corner. Yes, I love the beach. So I did that for 4 years and then did some research in psychology. And consequently, I went to PA school in Jacksonville, Florida.
Well, am I correct that you were with Novant Health in Charlotte prior to relocating here?
Yes, that's correct. I was with Novant Health Urgent Care in Charlotte, North Carolina for 2 years before transferring.
Well, where are you from originally? Because your name, Somplowski, sort of tells me you're Polish.
I am, yes. You're pretty good. Spot on, actually. Yeah, I was born in Poland, moved to the States 23 years ago, lived in New York, Florida, North Carolina, and so here I am.
Oh, well, welcome.
Thank you.
That's a really interesting background. Tell me a little bit more about what you do as a physician assistant at Oceanside Family Medicine.
So at Oceanside Family Medicine, I am in convenient care.
Oh, okay.
And I see patients anywhere from newborns to elderly, and I assess, treat, and refer when necessary and appropriate.
So do you treat walk-ins?
Absolutely, yes. I'm on the walk-in side.
Oh, great. Sometimes it's difficult to figure out where to go, to your primary care or to the urgent care or to the ER. So how should we decide that?
Yeah, that's a fair question. It's not often easy to figure out where you're supposed to go.
Right.
Over here at Oceanside Family Medicine, we have the family medicine side and family medicine providers. So we have established patients, and we also have new patients. And if they need to be seen after hours, hence we have convenient care. So our established patients, new patients, people that are new to us can come in and be seen when they can't see their primary care provider.
Right.
Also, the co-pays in emergency rooms are often much higher than at convenient care, and just the accessibility of our convenient care. Also, wait times are not nowhere near as long our convenient care as they are in the emergency room.
And I'm sure if you saw something that needed an emergent attention, you would just forward them on, send them on, or call
absolutely.
the 911.
Absolutely, without question.
Yeah, great. Now I know that Novant Health has a 24/7 nurse call system. Tell me a little bit about that.
Yes, that's available to our patients. They can call in. It's 910-721 care, and that way they can talk to our nurse, and the nurse can tell them further whether they need to be evaluated further in convenient care or go to the emergency room.
Okay. Just one clarification. Working in convenient care, you don't necessarily have standing appointments or your own patients. Is that correct?
That's correct. In convenient care, it's walk-in only, and so I don't have set appointments that I see patients. It's whoever comes in.
Are the providers in the practice taking new patients? Is the practice itself taking new patients?
Yes, there are a couple of new providers. They are accepting new patients.
Before we wrap up, I wanted to make sure I understood the hours of the clinic and what have you.
Yeah.
Talk to me a little bit about that.
Absolutely. We are open in the convenient care side from 8 in the morning until 8 p.m., Monday through Friday. Saturday from 9 a.m. until 6 p.m. Sunday 12 to 5.
Sunday 12 to 5. Well, that's great. I really appreciate you being here, and we're really glad to have you on board. And I hope you'll come back and see us sometime, and maybe we can talk more about Poland.
Oh, absolutely. Thank you so much.
That would be very interesting.
Thank you so much for having me.
You're quite welcome. Thank you for tuning in to ATMC TV's Health Watch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.coop. Please visit NovantHealth.org for more information on Novant Health Brunswick Medical Center, our local doctors, and general health information. Thanks again for joining us today. Be sure to join us next time for Health Watch on ATMC TV.